Hi, my name is Elle Doherty and I'm a program manager at Colorectal Cancer Canada. And today I'll be presenting our Never Too Young Patient and Caregiver Experiences survey results. Thanks for joining. So I'll start by providing a little bit of information about our Never Too Young program here at Colorectal Cancer Canada. So the program was created to address sharp increases in early age onset colorectal cancer cases in Canada and worldwide. The program aims to increase awareness about early age onset colorectal cancer among the general population, to support early age onset colorectal cancer patients and caregivers, and to sensitize the medical community about the unique challenges that early age onset patients and caregivers face. So today I'll be taking you through a brief overview of our findings from our patient and caregiver experiences survey, but we encourage you to take a look at the link that will show on the last slide in order to see the full report in detail. So the 4 sections of the report are background and methodology, participant demographics, diagnosis and treatment, and survivorship and outcomes. So this slide provides a little bit of background information about early age onset colorectal cancer in Canada. So we know that colorectal cancer rates in those above the age of 50 are declining. However, there has been a sharp increase in early age onset colorectal cancer cases, as I mentioned. And we also know that early age onset colorectal cancer patients and caregivers face unique challenges compared to those who are diagnosed at an older age. And the graphic that you see in the middle of the slide is our vision for our Never Too Young program that we hope to achieve by 2023. So this slide provides some information about the methodology of our survey. So our survey was reviewed by our Never Too Young expert advisory panel and was conducted using Google Forms. The survey was circulated online from September 2nd to October 15th, 2020, with 68 responses, 58 being survivors and patients, and 10 being caregivers. And although we did specify that the survey was for early age onset patients, we did not exclude those who began experiencing symptoms below the age of 50, but were actually diagnosed after the age of 50. At the bottom of the slide, you can see a number of different topics that we touched on in our survey content, which we'll get to later in the presentation. So as I mentioned previously, we have an amazing expert advisory committee for our Never Too Young program who reviewed our survey questions prior to the launch of the survey, and they also reviewed our survey report. Here we have some demographics of our participants. So as you can see, nearly half of our participants live in Ontario with 47.1%. We also had participants from British Columbia, Quebec, Nova Scotia, Alberta, Manitoba, and Saskatchewan. So to continue demographic information, here you can see our patients and caregivers' connection to colorectal cancer, their gender, marital status, current age, children, race, ethnicity, education, and community type. So we began the survey by asking our respondents about their awareness of early age onset colorectal cancer prior to diagnosis. So as you can see, 27.1% were aware that colorectal cancer can happen in those under 50. Only 15.7% were aware of the signs and symptoms of colorectal cancer prior to diagnosis, and a small proportion of our respondents spoke to their family, friends, or doctor about colorectal cancer risk factors before their diagnosis. Next, we have health and risk factors. So as you can see, the majority of our participants were moderately active or lightly active at the time of diagnosis. The vast majority of them were not smokers at the time of diagnosis. However, 38.5% had been smokers in the past for an average of 11 years. And you can also see that the vast majority of our participants did not follow any specific diet. However, we did have a number of diets that a small proportion of respondents followed at the time. So here you can see the average fruit and vegetable servings per day, which were 2.5 servings of fruit and 2.6 servings of vegetables. So it's recommended to have about 10 servings per day combined, with 4 to 5 servings of each fruits and vegetables per day. So as you can see, our respondents were below the recommended servings per day on both fruit and vegetables. However, nearly 60% reported that they rarely to never consumed sugar-sweetened beverages. And next you can see that over 50% of our respondents were either overweight or obese at the time of their diagnosis, with nearly 50% being in the normal BMI range at the time of diagnosis. You can also see that 64.7% of respondents did consume alcohol at the time of diagnosis. However, only 21.4% consumed 10 plus drinks per week. This slide is quite interesting as it shows the personal and family health history of our respondents. So as you can see, nearly 60% of our respondents did not have a family history of colorectal cancer. The vast majority of our respondents had no history of any other GI tract disorders or illnesses. And you can see that the family health history graphic along the top here shows that nearly 25% of respondents had no family history of any health issues whatsoever, followed by breast cancer in a little bit over 20%, GI cancers, prostate cancers, and so on and so forth. On the right-hand side of the screen, you can see a variation of different genetic mutations that patients did report. However, 50% reported that they were unsure whether they had any genetic mutations at all. So here we have the first onset symptom that patients reported. And please note that they were able to select more than one symptom, which is why the percentages will not add up to 100%. So you can see that 54.2% experienced blood in stool, which was the most common first onset symptom. Other common symptoms include weakness and fatigue, constipation, diarrhea, and bloating and gas. On the right-hand side, you can see that 40.4 years of age was the average onset of symptoms for our respondents. Next, we have the path to diagnosis. So you can see that above 30%, it took about 1 to 3 months from first onset of symptoms to seeking medical care, and nearly 30% waited more than 6 months to seek medical care following symptoms. And 72.4% of respondents saw their primary care provider due to symptoms, with smaller proportions seeing gastroenterologists, urgent care, or surgeons. Interestingly, 78.1% of respondents said they saw at least 2 doctors before they were diagnosed with colorectal cancer. So here you can see that 36.8% of respondents received their diagnosis of colorectal cancer less than 1 month after seeking medical attention. An identical 36.8% received their diagnosis longer than 6 months after seeking medical attention. And a smaller proportion of 17.6% took 1 to 3 months to receive their diagnosis, and 8.8% took 3 to 6 months to receive their diagnosis. It's also really important to note that 42.9% of our respondents felt that doctors dismissed signs of colorectal cancer due to their young age. So our survey also looked at mistaken and correct diagnoses prior to a colorectal cancer diagnosis. So you can see that hemorrhoids was most commonly diagnosed incorrectly, with 26.9% of respondents and 14.5% who were diagnosed with hemorrhoids correctly. You can also see IBS and IBD with 20.9% who were mistakenly diagnosed and 6.5% who were correctly diagnosed. It's also interesting to note that 25.8% of respondents were correctly diagnosed with anemia prior to being diagnosed with colorectal cancer. However, 40.3% of respondents did not receive any mistaken diagnoses prior to being diagnosed with colorectal cancer, and 59.7% did not receive any other correct diagnoses prior to their colorectal cancer diagnosis. As you can see on the right, as age increases, as does the rates of colorectal cancer among our respondents. Here's a quotation from a patient named Pierre who was diagnosed with early age onset colorectal cancer during the pandemic. He says, "Cancer doesn't discriminate. That was a big surprise when I was at the hospital during my chemo and IV treatments. I was walking in thinking I was going to be in a room full of older people. I was gobsmacked by the amount of people that looked younger and around my age, from all walks of life. It was not at all what I expected. It really was people of different backgrounds, different ages, different ethnicities, and I was shocked." And I recommend that you take a look at our story section on colorectalcancercanada.com to read Pierre's full story, as it is really impactful. Next, we have diagnosis information from our respondents. So as you can see, 44.1% of our respondents were diagnosed with stage 3 colorectal cancer, and 32.4% were diagnosed with stage 4. Although the majority of our respondents did not have tumor metastases, you can see that the most common was liver with 26.9%, followed by lymph nodes with 19.4%. The next section of the survey looked at genetic testing. So as you can see, 59.4% of respondents were genetically tested after their diagnosis, with 34.8% who were not tested. You can see that 78% did not test positive for a genetic mutation, where 16% did. And the vast majority of our respondents were told that their children and first-degree relatives should be screened 10 years before their age of diagnosis. So the next section of the survey discusses biomarker testing. So as you can see, 62.5% of respondents did not have an explanation of biomarker testing from their healthcare team. You can see that 35.4% did have biomarker testing conducted, and 43.1% of respondents were not sure if biomarker testing had been conducted. You can also see that the majority, at 60.9%, did not know if the results of biomarker testing informed their treatment plan. This section of the report was also quite interesting. So you can see that only 38.1% of respondents felt sufficiently informed about clinical trials, and 75.4% would consider participating in a clinical trial. However, only 16.7% of our respondents did in fact participate. You can also see that the respondents very much agreed that clinical trials are important for early age onset patients, with about 70% of respondents rating them very important, about 26% rating them somewhat important, and a small proportion rating them not important. This is a quotation from one of our Never Too Young program ambassadors, Aneta. She says, "On a winter February afternoon in 2019, days after my 45th birthday, I was unexpectedly diagnosed with stage 3B colorectal cancer. In short, I went through chemotherapy and radiation and had complete response to treatment. If I didn't keep my doctor's appointment, which led to the colonoscopy, the story could have had a very different ending." So the next section of our survey looked at ostomy experiences. So 46.8% of our respondents had a colostomy or ileostomy, either permanent or temporary. You can see in the graphic on the left-hand side of the screen that a large proportion of respondents dealt with stool leakage as a result of their colostomy. Other commonly cited experiences are ostomy interfering with sports and recreation, as well as sore skin around the stoma. So the next section of the survey looked at early age onset colorectal cancer and the impacts it has on sexuality and fertility. So the largest proportion of respondents said that they did not discuss any sexual side effects of radiation and surgery prior to their treatment. Commonly cited side effects include decrease in sex drive, painful sex, loss of sexual function, and infertility. You can also see that 60% of respondents did not receive any guidance from medical staff regarding their sexual health. And finally, you can see that 50% of respondents experienced a partial loss of sexual function at some point, and 3.7% experienced a total loss of sexual function. This slide includes just a few examples of our patient experiences with sexuality and fertility during early age onset colorectal cancer treatment or afterwards. The next section of the survey looked at the emotional health of patients and caregivers. So you can see that the majority responded that they were concerned about their mental health at some point. They also felt sudden feelings of panic and anxiety. A smaller proportion reported that they needed help for their depression, which is interesting. You can see that the majority felt withdrawn from other people, and the vast majority felt emotionally exhausted. In addition, 40% sometimes feared recurrence, 35.4% always feared recurrence, and 23.1% often feared recurrence. And below in the fatigue section, Around 22.4% felt that they had to limit social activities due to fatigue. 25.7% felt that their fatigue made it difficult to make decisions, and 27.5% were too tired to do everyday activities. So the next section of the survey looked at the impact of pain on patients. So you can see that the majority of patients did worry about pain at some point, with only 30.8% reporting never worrying about pain. And same with pain interfering with family and everyday life, with only 31.3% reporting never. Next, you can see that there was mixed feelings about the coverage that insurance was able to provide. And finally, at the bottom, you can see financial health and the concerns that some of our respondents felt around financial stress, the cost of cancer care, future finances, and optimism around financial future. So the final section of our survivorship and outcomes section talks about employment as well as coping. So you can see that 78.3% of respondents were employed at the time of diagnosis. 76.8% of respondents had to take a leave or quit a job due to diagnosis, and 79.2% of respondents' employers accommodated their schedule. You can also see that the majority of patients are able to enjoy life, with only 1.7% who reported never, as well as the majority reporting that they are satisfied with how they're coping with their illness, with only 1.8% reporting never. So we do encourage you to check out our full report to read through the biggest challenges reported by our caregivers and patient respondents. However, we did notice a strong theme of lack of peer support among early age onset colorectal cancer patients. Here are some of the main takeaways from our survey. First, there are a number of important gaps in the Canadian healthcare system impacting the experiences of early age onset colorectal cancer patients and caregivers. There also seems to be a lack of patient knowledge and involvement around clinical trials, biomarkers, which highlights a need for shared decision-making between patients, caregivers, and their medical team. And finally, it is clear that early age onset colorectal cancer has a major psychosocial impact on patients and caregivers. Patients need more resources in mental health, sexual health, and peer support. Colorectal Cancer Canada will use the information gathered through the survey to inform our programs and advocacy initiatives, with the ultimate goal of reducing the gaps in resources for early age onset colorectal cancer patients and caregivers. We would like to thank the patients and caregivers who participated in the survey, our expert advisory panel for their input and expertise, and our partner organizations for their ongoing support. This initiative was made possible by the generosity of Ellen Walker Matthews and Tom Matthews on behalf of their son, Chris Gordon Walker, who passed away at the age of 29 due to stage 4 colorectal cancer. Thank you so much for watching this presentation today, and do not hesitate to reach out to me if you have any questions or concerns. You can see my email address and phone number here on the screen, as well as the link to the full report. Thank you.